As I understand that melanoma is not just a disease of fair-skinned people, but is also being seen in Hispanic populations. Can you tell me about that?
Well, it seems that because of the increase in the population of Hispanics in the United States, we're a little more aware of what is happening to that population. There's been a recent study published that shows that there's been an increase in the incidence of melanoma by 20% in the last 2 decades.
And why do we think there's been an increase in melanoma?
Now that we know the fact that there's been an increase, we're trying to explain why is that increase. There might be 3 factors. And they might include the fact that the dermatologists might not know that the Hispanics are prone to skin cancer, including melanoma, that the Hispanics themselves don't know that they're prone to skin cancer and melanoma, and that they lack the resources to be evaluated by a dermatologist.
Okay, so does this go back to, like, we've all had this sort of misperception that melanoma is a disease that fair-skinned people get?
Yes, melanoma is a disease that can affect all of us. There's a genetic component, and there is the sun exposure component. We can get rid of the behavior on the sun, but we cannot get rid of our genes. So we all need to know that we can have melanoma.
And so do you think that Hispanic people and dark-skinned people of all ethnic backgrounds don't take sun protection seriously?
That is actually, there's evidence in the literature that demonstrate that that is a fact. If you ask the Hispanic young people in Florida if they use sun protection, if they use, they do examination of their skin, more than 65% of the population do not use any safe precautions under the sun, and they actually go to tanning parlors before they get to sun exposure just for leisure. There's another way that other studies that have demonstrated in a clinic where there's a whole population of people of color. You look at their behavior, if they know that they get exposure to the sun, if they get sunburn, even though 65% of the population knew that they got sunburn, they did not associate the sunburn with skin cancer. Wow. So there is a lack of understanding that they are prone to melanomas.
So very quickly, what is your organization, the American Academy of Dermatology, or you personally, or anybody else trying to do to fix this?
Well, the American Academy of Dermatology is doing 3 things. They're trying to bring conscience and knowledge to the dermatologists. There is a new forum that is going to be presented at this academy based on the important facts about the Hispanics. Then there's 2, there is campaigns to show the Hispanic community the propensity that they have to melanomas. And 3, we need to get these patients to have some exposure to doctors of board-certified dermatologists. And if we cannot do it physically, maybe we can just do it through teledermatology.
Okay. Sounds like a lot of work to be done, but important work, so thank you very much for doing that.
Thank you.
Okay.